Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us is Dr. Robert Popovian in Washington, D.C. He's a pharmacist, an economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, as always, Ben Blanc, dialing in from the heartland of the United States, Indianapolis, Indiana, and our Associate Director of Digital Production and Engagement. Happy New Year, Ben. How was your holiday?
Happy New Year to you, Robert. I had such a great holiday, and I hope you did too. And we're actually back with Season 6 of Healthcare Matters, which is really exciting. And we have much to discuss. If you were all thinking that 2025 would be a breeze, well, you might want to rethink that. It's a pivotal year. We've got a new administration coming in. The Trump administration 2.0 has already been taking shape and included a bunch of announcements toward the end of 2024.
So first of all, yes, it is Season 6. Ben, we're going to try to break the record of Law and Order. We're going to be together for another 20 years. So I hope you're ready for that. But that's right. You know, Republicans took control of both the chambers of the Congress, both Senate and House, as well as obviously they have the executive branch now in their control. So their big question is, what does this mean about health policy and our patient community, especially patients with chronic diseases that, whether or not we like it, they're around and we need to manage their care and we need to support them.
Well, let's get to it. And today we're tackling a topic that is critical to both individual and public health: vaccines. Vaccines are often called the most cost-beneficial intervention in healthcare, and yet challenges like misinformation, access barriers, and vaccine hesitancy remain persistent. Joining Robert and me to unpack this today is Seth Ginsberg, the president and co-founder of the Global Healthy Living Foundation. In this episode, we'll explore why vaccines hold such a unique place in healthcare, what the barriers to access are, and how advocacy can help rebuild trust and improve immunization rates. Now, before we dive into today's discussion, let's start with the big picture. So, Robert, vaccines are widely regarded as the most cost-beneficial intervention in healthcare. But why? Can you walk us through that and explain why vaccines hold this distinction? And perhaps you could share some examples where high immunization rates led to significant cost savings.
Since I've been around health policy, which is about 30 years, vaccines have always been considered the most cost-beneficial intervention in the healthcare system. And, you know, there's multiple examples, both in the adult space and the pediatric space. The most concrete one of the ones that happened in the early 1980s, was the eradication of smallpox. We eradicated smallpox worldwide. It costs around $300 million, but guess what? The savings that has accrued over time, it's about $1.35 billion. So significant savings. But this is not just about smallpox eradication. There's also management of the disease. There's data with regards to pneumococcal vaccinations of adults 65 and older over a decade. In 10 years, we've prevented about 211,000 hospitalizations, about 13,000 deaths. And, you know, let's not forget, the most recent example is the COVID vaccine. I mean, I was a co-author on a paper that the Progressive Policy Institute released last year, quantifying the value of the COVID vaccine. And, you know, it was about 2.9 million saved lives and reduction of about 12.5 million hospitalizations because of that vaccine. So let's not lose sight of the benefit of this enormous innovation in the healthcare system and how it helps not only adults, pediatric patients, but especially patients who are vulnerable, and that's the patient population that Global Healthy Living Foundation most often serves, the chronic disease patient.
Right. And Robert, you just mentioned one of the papers that you worked on last year. Of course, we'll place a link to this paper in the episode description for this episode. So vaccines really do show how preventive care can save money and lives. Now, I want to talk about the results of a recent GHLF quick poll from late last year. This survey really sets the stage for today's discussion. We surveyed about 2,000 patients about seasonal vaccines like flu and COVID. And one concerning highlight for me is that over 11% of respondents said that they didn't plan to get vaccinated this past fall, and 54% voiced concerns about accessing vaccines. And I want to say these aren't just data points. They are a call to action for patients and organizations like GHLF. So Robert, could you tell us how this survey came about and what steps we need to take to challenge the system and address these issues?
Well, the survey is not something new. We continuously survey patients, a variety of our therapeutic areas that we're involved in, especially regarding chronic diseases, and we've done multiple surveys on vaccines as well. And so we wanted to learn more about what is the perception of vaccination, especially considering post-election with the new administration coming on board. And you're right, Ben, the data is actually abysmal. 10 or 11% of patients with chronic diseases who are engaged with GHLF have decided that they're not going to get immunized this respiratory season. That is a scary proposition for patient population, and especially patient populations that are vulnerable. So what do we do about this? Frankly, it's more education. And this is why Seth is here, because we're going to talk about how GHLF needs to get engaged in this space with regards to education and advocacy to really reset the thought process of patients concerning immunization and vaccination.
Well, thanks, Robert. Hearing about these numbers really put things into perspective, and the fact that so many engaged patients are still hesitant or unable to get vaccinated is alarming. I mean, clearly, there's more that needs to be done. And we'll talk about education in just a minute, but we also need to ensure vaccines are accessible to those who need them most, right? So can we briefly touch on that, Robert? What are the biggest challenges preventing access to vaccines, especially for vulnerable populations?
We removed one of the barriers through the Inflation Reduction Act. We eliminated the out-of-pocket cost for seniors for Medicare Part D vaccines. And that was important because, remember, seniors, elderly benefit the most from vaccination. And for some odd reason, which is unbeknownst to anyone, they were the only population that was forced to pay out-of-pocket costs for immunization. None of us that are in the commercial sector, in the private sector, through insurance, were paying anything, but the seniors were making. So I already took care of that. That was one barrier that was removed. It was a significant barrier. And there's data that shows that there's more immunization among seniors because of this Inflation Reduction Act removing that out-of-pocket cost issue. But it again comes down to perception, education, and this is why Seth is here to talk about a little bit of it, but also access. One of the things that we've done a lot of research on at GHLF is the access barriers for, especially in underserved communities. We've looked at how are patients acquiring those vaccines, what are the barriers of them acquiring that vaccine, and one of the main barriers is just the location of vaccination and immunization. In vulnerable, underserved communities, pharmacists are most accessible entities, more accessible than physicians, and for some odd reason, there's certain states, including the one that GHLF is based in, New York, that has decided that they're going to curtail the ability of pharmacists to immunize. And it's the ironic part of New York State is that there are more pharmacies in underserved communities than actually physicians who immunize. And we've looked at this data over and over again. So access barriers is one of them. But I want to have Seth's input on this because he's going to talk a little bit about advocacy and education, because those are the peers that we need to get through to the patients to make sure that we're level setting the value of immunization.
Thanks, Robert. And Seth, I see you nodding.
Yeah, there's a lot to unpack with this. First of all, it's great to be here, and I'm really glad to be talking with you. And it's fun to listen, and then now to be a part of this conversation here in the 6th season, right? And beyond, hopefully, if I'm invited back. Anyway, let's get into this, because it was very alarming to ask thousands of patients from all around the country about their situation, their perspective in vaccines. Really highlighted some alarming issues, both from concerning access issues, a trust in healthcare system, and misinformation standpoint. And these highlight this significant gap in our healthcare system's ability to meet the needs of its most vulnerable patients, people who have these chronic diseases. And the silver lining from what we learned was that it was, I think 89%, right, of respondents trust healthcare providers as their primary source of vaccine information, which underscores this critical role that our doctors and nurses and pharmacists play in combating misinformation misinformation and promoting vaccine uptake. Because let's face it, there are these systemic barriers and on-the-ground issues Robert was talking about. We're getting access to actual vaccines. And then there's the like quote-unquote meta issue, which is what everybody, I guess, as a double entendre there, how everybody is thinking about vaccines and what it's all about in their hearts and minds. And therein lies our biggest issue, I believe. How we as a society in the year 2025 think about our health and our well-being and our community's health and our community's well-being really needs help. And that's what GHLF is here to do. So look, flooding the airwaves with credible, accessible, understandable, relatable information is a huge first step for us and something that GHLF can do effectively. You know, we have trusted, evidence-based, credible, but really relatable and understandable information that we put out. And a perfect example to plug another podcast here, the crossover here would be the Informed Immunity series that we have. This latest season have these great topics like vaccines, separating fact from fiction. Another one about navigating healthcare systems and overcoming barriers to vaccination. A great one, boosting vaccine knowledge and community access. And then one of my favorites, the future of vaccines, advancements and hope for chronic conditions. And the idea here is help people understand from the inside out the situation related to vaccinations so that the conversation can be moved forward in a helpful, productive, and most importantly, healthy way. These seasonal issues, these respiratory viruses, and we added COVID-19, even though it should be 19-25, it was discovered in 2019, I guess. That's why it got that number. But as far as I'm concerned, it's COVID-25 right now because it's a real and serious threat still for many vulnerable people. It's not going away. We know tons more about it today than we did 4, 5, 6 years ago. And as a result, we have these both protective opportunities in vaccines as well as afterwards now, the antivirals that we see and use and now know work when you do contract the condition and fall seriously ill, especially. So there's a lot we need to do from an educational standpoint, from an awareness and outreach standpoint at macro level, at the global and national levels, of course, but also really at the community level in our local towns and villages and communities and schools and churches and synagogues and everywhere else we hang out with each other so that we all move forward in the right direction and take advantage of the medical science that we have today in the form of vaccines. And we don't lose our kids, 1 out of 2 of them or 1 out of 3 of them, to these awful infant diseases and our kids choking to death and die in our arms the way they did, but 1, 2, 3 generations ago prior to vaccines. And therefore, we just don't see it as an issue, and it isn't necessarily something that we understand the profound urgency to protect against. And that's why groups like GHLF are here, because we really want folks to get that in their hearts and their minds. So, like I said, we can move forward together in the right direction.
Thank you, Seth. That's really an important point, and those were really powerful examples that you gave. And what I'm hearing is we need more than just medical solutions. We need community engagement, advocacy, and what we do at GHLF really makes a difference here. And Seth, you also mentioned the second season of our podcast series, Informed Immunity. I wanted to let our listeners know that, of course, we'll place all the relevant links in the episode description, and that includes the links to season 2 of Informed Immunity. And Robert, I think you wanted to react to what Seth was saying as well.
I don't know if anybody was paying attention, but yesterday, which is Monday, January 6th, CDC put out a statement regarding the spike in respiratory illnesses in the United States, COVID, RSV, and flu. And what they're seeing is that there's a spike in hospitalizations, in ER visits, and they predict that it's going to keep growing. And that's normally during this time of season because everybody gets together. We're in closed environments with regards to the weather, and there's a lot of transmission of illness. But, there's still time for us to protect ourselves through immunization. But The data is real, the ER visits are real, mortality is real, morbidity is real. And we cannot deny that vaccines are going to help curtail that. The more we raise doubts, the more we refuse to get the vaccine, especially the population that we serve, the more vulnerable we're going to be to these illnesses long term.
But a question back to you, Robert. I hear from people all the time that they don't like vaccines because essentially they don't like vaccine makers or the drug companies. And the whole conversation quickly devolves into this trust issue with drug companies. How do we address that in a productive way so that the baby is not literally thrown out with the bathwater?
Well, it's through direct communication, first of all. Next is utilizing real data to demonstrate the effectiveness of these vaccinations. But the other thing is to be honest about vaccines. One of the situations that came up in COVID is that the misperception that contributed to some of the hesitancy and skepticism is that if you get the vaccine, you're never going to get sick. That's not true. The reality with vaccines, and it's always been the situation with vaccines, is that it reduces the burden of illness. There's two real things. Actually, it reduces burden of illness. So if you get the vaccination, you most likely are not going to get as sick, and it's going to reduce the mortality, morbidity rate. But the second reality is that this is another misperception that is out there, is that immunity through infection, that means if you get infection and you develop the immunity, is far superior than the vaccines. The reality is that, no, that's not the case. They're equal. Actually, if you get immunity through infection or vaccination, the immunity is pretty much the same. But the problem is this, and nobody wants to talk about it, Seth, what you just said, is that for you to be able to get natural immunity, you have to get sick, you have to go through the illness, and then develop the immunity, versus the vaccine sort of skips that illness portion. And the reason this is important is because if you get sick and you're a vulnerable patient, like somebody who has chronic diseases or chronic lung disease or chronic heart disease, you may not come out on the back end with the immunity. You may be either hospitalized or dead by that time. And that's the thing that we need to be honest about with patients. You should say, look, we understand natural immunity is as good as vaccination, but remember, for you to go through the process of natural immunity, you actually have to get sick to go through the illness and potentially risk mortality and morbidity before benefiting from that. So those are the things that we need to do, I think.
Thanks, Robert. And should we double down on why advocacy is so important? Seth, I'm turning to you. Can you tell us a little more about the role that GHLF plays in advocating for vaccine access and education? And I'm actually thinking about our advocating for vaccine training that we launched late last year. Can you tell us a little more about that program and how it will help equip patients and advocates to drive change in their communities?
Great. This is perfect. Another amazing plug I get to make here. But importantly, I think a relevant one, because look, information is key, and getting this information out to folks is really important. But getting the right information, especially to the right people, is most important. And that's why we developed this free vaccine advocacy training program that our 50-state network, which is GHLF's advocacy arm in all 50 states in Puerto Rico and DC, has developed specifically to empower people to advocate for themselves and within their community using their stories, understand how vaccine policies impact access, and addresses common myths and share ways that they can provide reliable science and evidence-based information. And what we've done is package this thing up in a user-friendly way. Of course, it's free, and we designed it to share with people so that they can then become empowered and have these tools to be vaccine advocates in their community. Using our personal stories, especially people with chronic conditions who are medically vulnerable, are the most powerful ways that we can communicate information, especially related to public health and specifically for vaccination topics. So our vaccine advocacy training and resources are available on our 50-state network website. I'm sure we have a link at this show for them as well. And we encourage everyone to check those out, flick through them, watch a few of those videos, and then download some of the materials.
Thank you, Seth. But we can't talk about vaccines today without addressing the elephant in the room, leadership in public health. And I'd like to get both of your thoughts on this. RFK, Robert F. Kennedy Jr., who is Trump's pick for Secretary of Health and Human Services. As a longtime vaccine skeptic, his past comments and work could definitely influence public perception. We're talking about someone who in 2023 said, "There is no vaccine that's safe and effective." Someone who also founded an anti-vaccine group called the Children's Health Defense. How should we, as healthcare advocates, address this? Robert, do you want to start?
In this podcast, we don't really get into political issues because one thing I've always said is that when somebody gets sick, and whether they have cancer or they have respiratory illness or arthritis, it's apolitical. They want the best medicine because at the end of the day, whether you're a Republican or a Democrat, those drugs are going to save your life. And those drugs don't act any differently for a conservative or a progressive person or a liberal person. However, it is concerning that we have a leader within HHS that has raised significant concerns about vaccines without much evidence. And that's what we need to get back to. I think it's a healthy discussion to have because clearly there is some hesitancy in the marketplace among patients about immunization even before RFK Jr. was named as nominee for Secretary of Health and Human Services. His nomination is just going to accelerate the discussion and the debate that we need to have. And this debate and discussion needs to be very public. It needs to be very transparent.
And allow me to just throw a lot of gasoline on this fire here, because just today at recording, the news broke that Meta, or Facebook and Instagram, is ending its fact-checking program in favor of a community note system similar to X or Twitter. And what does this do to the cause? I mean, it makes it a lot harder, essentially, to your point before, where we really need to double down on evidence-based information that is as sound and grounded in fact and provable information as possible to make decisions at a policy level, at a regulatory level, at a medical level, and at a personal level. And of course, I guess at a professional level for that matter. And, I think it's a bit treacherous if we're out talking about things that aren't rooted in fact and are based on guts and hunches and feelings and personal experiences, which is fine. But if we're making decisions on stuff, we really kind of have to do two things. One, we have to separate church and state as much as possible. That's one way to think about it. And second, we have to just stay tethered to science and fact. And here's to hoping that everybody inside and outside of the Beltway in Washington does so.
And again, to reiterate, I don't think it's unhealthy to have this debate as long as it's transparent and based on fact, like Seth said.
Right. And Seth, you were just talking about the importance of the decision process. And one word that often comes to mind when talking about making decisions is collaboration. Collaboration is a key public health element, right? Especially when we see concerning data from a survey like the one we just discussed. And to wrap things up, I want to ask, how can healthcare providers, advocacy organizations like GHLF, policymakers, and even private companies work together to address these challenges, improve vaccine access, and create meaningful change?
Definitely. Collaboration is key. Our recent data from our most latest poll should be a wake-up call for industry collaboration, for policy collaboration, and for community collaboration. And advocacy organizations like GHLF, Global Healthy Living Foundation, healthcare providers, and manufacturers need to work together to address misinformation and reduce access barriers at the same time.
So I would add that as providers, and I'm a provider, we have a responsibility to be able to educate and talk to patients, talk to them, not tell them stuff, not force them into situations, but have actual conversations with them and address their issues. Because, again, remember what Seth said, 89% of the people that we surveyed, they trusted their healthcare professionals with information. So we need to take that responsibility on. We cannot shirk it. We cannot escape from it. It's a reality of the situation. We are the trusted voice for patients, and we need to basically come up with a way to be able to do that.
And I'll tell you the way, though, Robert, patients with chronic conditions are at the heart of the issue. Their stories, sharing their stories and experiences can humanize these statistics and drive the change. And like our podcasts and resources like Informed Immunity are a platform for those voices to be heard. But with over 50%, I should say, of the survey respondents concerned about access, manufacturers must invest in partnerships that address systemic gaps, whether through education campaigns, patient advocacy programs, or policy advocacy, because this is a problem that requires all hands on deck to address.
Couldn't agree more. And I want to go back to the original statement. Remember, the survey that we did, which is 1,500, 1,600, close to 2,000 patients, 10%. And remember, these patients are chronic disease patients that have a relationship with GHLF. They know us, they work with us, they come to us as a community to get support. And 10% of them said they have no intention of getting immunized in this respiratory season. That is a concern. Can you imagine what the numbers look like in the general population then?
Thanks, Robert. And what I'm hearing today is advocacy, grassroots efforts, and collaboration among providers, you, Robert, policymakers, and organizations like GHLF are essential to rebuild trust, to expanding access, and driving meaningful systemic change in vaccine education and delivery. But I'm not the expert, so Robert, you have the last word.
Vaccination are the most cost-beneficial interventions in the healthcare system. There's some healthy skepticism on vaccinations that we need to address. Healthcare professionals need to take the lead on that. We need to have conversations. We need to have a healthy, transparent, fact-based debate about vaccines. It needs to happen sooner than later because, as we discussed during this podcast, the data that's coming out is abysmal. Patients are not getting immunized. The respiratory illnesses are increasing over this season, and more patients are going to get hospitalized or die from this. This is a serious outcome. We're not talking about a couple of sniffles here. We're talking about patients ending up in the emergency room and ICUs and eventually in the morgues.
Well, thanks for breaking that down for us, Robert. And Seth, thanks again very much for joining us and for sharing your insight. And to our listeners, that's it for us. So don't forget to subscribe to our podcast on Apple Podcasts, Spotify, or wherever you might be listening so you never miss an episode. If you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your family and friends. It will help more people like you find us.
So I want to thank Seth for coming on. This was a really good conversation. We need to have more of these. I want to make a couple of plugs. Number one, be on the lookout for the survey results. We're going to put it out pretty soon. We have a couple of other studies coming out that we're going to feature at the World Vaccine Congress on April 24th. If you happen to be in DC, please attend that session. We're going to be discussing about access to vaccines. And my third plug is that always get in touch with the folks at GHLF. You can reach out to us with regards to podcasts at ghlf.org. Let us know what you want to hear about. We talk a lot of different things about the healthcare industry, including access to care, vaccination, drug pricing, so on and so forth. And we will feature you if you happen to have a very good idea and you want us to bring you on and you can talk about it. We're more than happy to do so.
And before you go, make sure you take a listen to some of our other great podcasts on the GHLF Podcast Network. You can find all of GHLF's podcasts at ghlf.org/listen. He's Dr. Robert Popovian.
And he's Ben Blanc. We'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.